Avik Roy is a senior fellow at the Manhattan Institute. He's also newly named the opinion editor at Forbes. He is the creator and primary contributor to The Apothecary, one of the primary blogs, not only on Forbes, but really on the internet about health policy. And Ezra Klein is quoted in his bio, actually, as saying it's one of the few blogs that he reads regularly that he disagrees with. So welcome to you. Thank you very much for both of you for joining us. And thank you, Avik. Thank you, Ezra. Take it away.
And welcome, Ezra. Thanks for coming. You're a busy guy these days. You all know Ezra, so I barely need to introduce him, but I will say that he is the founder of Project X. Is that the official name or is that a code name?
It is a official code name.
An official code name, all right.
Until we announce an official name.
Until we have official name. Okay, so he's the co-founder of Project X, which is a very interesting new effort to change the model of journalism, or at least to evolve it, take advantage of all these new digital tools. That we have something that's a topic that's near and dear to my heart as well. And let's see, what might you not know about Ezra? He's the son of a math professor from UC Irvine. Did I get that right?
That is right.
And that's why he loves the numbers so much.
That is wrong. I rebelled against math for a long time.
Okay, that's true. That's true. You're actually, it was like me. I rebelled against healthcare for a long time, but then it was the osmosis or what with my dad.
I'll say, I'm okay at math for a journalist. I am extremely bad at it for a mathematician. So my math skills are not sitting here making my dad proud. Washington is a place where you can be considered very good at math if you can't do regression analysis.
It's like Hollywood for
yeah,
nerds,
it's like
but
Hollywood,
about math.
Yeah, exactly.
Yeah. I should say, as the opinion editor of Forbes, that he's once again a member of the Forbes 30 Under 30 list. When's your birthday? Because you're 29 now. When's your birthday?
Yeah, I'm out next year. This is it for me.
Okay, because I think around Washington, whenever your birthday is, there's going to be a celebration. All the people you leapfrogged in the media are going to finally not have to hear anymore that you're a 20-something. So I think that will be an interesting moment in 21st century journalism history. Ezra turns 30. But I think, let's talk a little bit. We are obviously here to talk about healthcare, but let's talk a little bit about what you're doing at Project. Actually, what would be interesting to think about it this way is, how do you feel the media has covered Obamacare over the last 4 years? As a media critic, like you are, a professional media critic in a sense, in that you're starting something because you think the model of journalism has been inadequate. What do you think that journalism has done well and done poorly in covering healthcare over the last 4 years?
Sure. So there has never been a time in human history where the average American could find out so much goddamn information about a CBO report. This is, like, if you are judging journalism in terms of the quantity of CBO-related information that is now available, like, we are at an apex. And I actually think that's, like, an important part. We have gotten much better at a couple of things. So when I think about the print to digital transition, I think about there being three primary differences. One is speed, and we're real good at being fast compared to how we were 10 years ago. In some ways, we might be too good at it. The other is length. In general, the primary binding constraint at a print newspaper or print magazine or print book is how many pages you can actually fill. You can only have as many you can advertise behind. And more than that, every new one creates extra cost on the whole product. So you really have to be boiling down what you do. You can't go deep, is what that means for issues where there's not going to be a high readership for it. Online, obviously, there's no length constraint. I don't think the media uses that well as a general point, but it has been a kind of a revolution for policy coverage, because we can write 10 posts upon a CBO report. We can go deeper and deeper and deeper and deeper, and that isn't just an advantage for the reader, or for the engaged reader, I guess. It also is very important for the writers, because the ability to keep burrowing into a subject means the ability to keep learning about the subject. Prior, if we had done the CBO report on day one, say the labor supply one, and I've been out of the news like for the last month, and I remember checking and being like, oh, a CBO report came out today about labor supply, okay. And then on day 3, realizing people are still talking about it and thinking, what has happened to you people? How is this still the top story? But so we do on blogs and in other things like The Apothecary, we can go deeper and deeper and deeper, and that's been good for readers who are really interested, and it's been good for the writers because the writers can get smarter quicker. And the third then is persistence. The old technology, you wad it up and throw it away at the end of the day, use it to start fires, use it to wrap fish. It goes away, and an enormous amount of the culture of journalism is built upon the assumption that what we do disappears at a certain point, like literally disappears, is inaccessible to the reader. A world in which that doesn't have to happen is so different of a world, and we have barely begun to scratch the surface of it. So in terms of Obamacare, what I think all this has meant is that we have done a better job, certainly than anybody was able to do in 1994, of answering the question for people, what should you know today about Obamacare? If the CBO report came out today, there are tens of thousands, hundreds of thousands of words of analysis of it. If today is a day when we found out 3 million people enrolled, there are endless posts about it. We are great at what happened today in Obamacare, from any perspective, at any level of expertise you would like. What we are very bad at is a question that actual human beings might ask, because no human beings ask what happened today in Obamacare. What we are very bad at is a question of what is Obamacare, or what is in it, or how will it affect me? And that's because fundamentally the most important parts of the bill have not been in flux that much. If you think back to the actual coverage of the Obamacare debate, it was like 9 months of the public option. Almost every single article published was on the public option. Not literally every single one, but if you compared, say, the number of articles about the public option, which didn't exist in the final bill, and even if it did, would not have been all that central to it, and take that and compare it to the number of articles about how the exchanges were going to work, it's like trying to multiply things by 0.
You know what's interesting about that, too, is I remember a piece that Jonathan Cohn of the New Republic wrote after the ACA was passed. I think it was his last blog entry for his old Citizen Cohn blog, which was his healthcare blog. And it was kind of like a valedictory speech where he talked about the debate leading up to the passage of the law. And one of the things that he mentioned in that was there was this episode that you and I have both discussed before, which is AHIP, the Health Insurers Trade Group, published a study that was done by PricewaterhouseCoopers, looking at what premiums would do under the ACA. And they argued that premiums would go up. Democrats went into overdrive, really attacked it. You had interviewed John Gruber, the guy who designed Obamacare to a large degree in Obamacare, and Gruber said, the one thing we know for sure is that premiums in the individual market will go down under the Senate Finance Committee bill. And he's like the Obamacare. In fact, Paul Krugman, when he talked about Project X in one of his columns, said, well, the great thing about the sophistication of journalism, we can now go to guys like Gruber. Ezra can call Gruber and say, here's Gruber's take. He's the expert. Gruber says, the one thing we know for sure is that premiums will go down. But, of course, that hasn't been the case. The Gruber assessment of non-group premiums was wrong, wasn't it? Or so
I would honestly so the PricewaterhouseCoopers report, I just don't remember.
That's fine.
Just to be completely frank with you, so I'm just not going to try to debate a report I don't remember. In terms of premiums, and I'll let John Gruber speak for his own things because, again, I'm actually don't have his report in front of me.
It's all right.
I think that we've seen a variety of things happen in the debate about premiums, which speak on the one hand to a certain level of simplifying during the debate over the bill, and then speak to a certain level of oversimplifying after the bill. And what you've seen is, compared to the estimates of premiums that we were discussing, and I do remember having Evan Bayh go to the Congressional Budget Office and say, how much will premiums be? The Congressional Budget Office comes back and says this thing, and it says they'll go up by X, but the way they'll go up is because a lot of people are going to take subsidies and buy better things, and we had to go through this whole report. And it's come in at this point underneath those estimates. So the core estimates that most people were relying on once we had the CBO come out, the Affordable Care Act is undershot. At the same time, there is an effect, which you've written about a lot, in which we are compressing a market. And so you get into a question of who are you talking about? Premiums for whom and on what measure? And that's where we get into this debate. Is John Gruber right or is John Gruber wrong? Is the Avik-Roy rate shock arguments right, or are they oversimplifying? Because when you compare the numbers on e-health insurance to the people who are buying, a lot of those people couldn't buy at that rate. A lot of those people were getting quoted a higher rate at a later time, about 25% of them in a lot of cases. So this is a place, of course, where at some level, as much length as we have, right, as much capacity as we have to go into the details of it, we still never get to the point of true sort of clarity.
And in fairness, it's not like conservatives were really talking about the actuarial science of the way Obamacare would change the non-group insurance market in 2009. Those articles were not widely being written in the conservative press. So it's, to whatever degree, I'm saying the liberal press didn't talk about it, neither did the conservative press.
Well, I also think that just something that happens when you're talking about a law versus when you're covering a law, and this is just a general thing in the press, right? When you're talking about a law, it's all abstract. And so we've got these sheets of paper, some of them written by people in this room. And these pieces of paper tend to say, here's an average, here's an average, here's an average, here's an average. And then you get into the actual implementation of the law, and suddenly the world is not an average. The world is people. It dissolves down into people. And some of those people are in better shape, and some of those people are in much worse shape. And in general, and I don't think we've done this unfairly to Obamacare, but in general, as the old saying goes, there are no articles about all the planes that land safely. So, the cancellations are a great example of this. These are not something that should have surprised anybody who was paying attention to the bill's construction. I mean, the fact that there was going to be a lot of insurance products that did not meet the standards set out under Obamacare was not something that nobody mentioned in the bill. But it was a reasonably small enough number in the scheme of things that people just didn't pay much attention to it. I remember writing a number of times that, well, on the one hand, this is going to happen, but on the other hand, my problem with Obamacare is it doesn't change enough insurance arrangements, that I thought we needed a much more disruptive kind of reform, and I thought we had a lot of insurance that we needed to change, and that my big criticism, one of my sort of end of Obamacare passage posts was, what didn't the law do? And sort of my line was, it didn't disrupt enough of the existing insurance market, that the employer-based market, where a lot of the problems were, particularly in terms of cost, wasn't getting significantly touched, at least until 2018. But then, of course, you go to the other end, and or the other side of the law, and 500,000 people, or 1 million people, or whatever we want to say it is, isn't a huge number of people in America.
In terms of the cancellations, you mean? I think the number is 6 million or something.
So people have argued about who did and didn't get their stuff renewed and so forth, and I've heard a number of different numbers. So again, I'm not.
The White House disputes those numbers.
I'm happy to say 500,000 to 6 million.
Okay.
The point is that in general here, that we get into a problem where and this is, I think, a failure on our part as journalists, right? Where that seemed, we got so involved in talking about how the aggregate would move that the pockets of pain just don't get nearly as much attention in the construction process as they do on the other side. And I'm actually not sure, by the way, which one is correct. I'm not sure if it's correct that we focus on the aggregates on the front end, or that we focus so much on the pockets of pain on the other end. So both of them, I think there's an argument for.
Because the reason I bring up the Gruber point is you mentioned that, we can analyze these CBO reports, and you're right. The amount of information that we can analyze has exploded. The amount of data that we have access to. Like a guy like me sitting in his pajamas in New York didn't have access to CBO reports. In the old days when Jim Capretta used to do it, he'd actually have to go to the government printing office and actually look at the report with his own hands. Now amateurs like me, well, I'm not an amateur anymore, I guess, technically, because I'm paid to do it now.
You can't go to the Healthcare Olympics anymore.
The analysis is out there, but are we more accurate? It seems to me that if you looked at the coverage, if you look at even you look at CBO reports, I mean the CBO. I think it was Tom Coburn just put out a thing the other day about comparing the CBO estimates of various health programs, or the congressional or official government estimates, compared to what they ended up actually spending over time. And there's massive gaps, most famously with Medicare. So I feel like there's a lot of data, there's a lot of analysis. There are a lot of academic economists that can now have blogs or can write or be quoted, but they're often wrong, and the predictions they make are often wrong. And you have guys like PolitiFact saying, well, the CBO says X, and that's a fact. Well, it's not a fact that in 2023 spending will be X. That's a prediction.
We are more informed. Whether we are more accurate, I think, is an interesting question. I think it is a advance in the level of human knowledge for us to be talking about healthcare reform in terms of CBO reports, and for there to be certain baseline levels of facts that we agree on as a reasonable best guess, right? Otherwise, we're just in a complete thicket of ignorance. But obviously, you need to be careful with any of this, right? You need to be reasonable about the level of uncertainty. I think always to their credit, every CBO report, I think they are so damn good at saying how little they actually know. I think if you read those reports, they are very careful.
That's fair. There's a lot of caveats in those reports.
They really do say, here's what we know, here's what we don't know. And a lot of that nuance gets lost in the press. I mean, but we do this on everything. I mean, one of my favorite examples is during elections. A lot of polls will get reported, as if it's not a poll number, but the new fact, right? So whatever, Barack Obama up by 6%, but he's not actually up by 6%. That's just the outlier poll that we're now reporting for the very fact that it is an outlier. So, I think that there is a danger of getting into a kind of a specificity we don't have. On the other hand, when I look back, I don't think we knew more about, say, the Clinton bill. When I go back and read the coverage, it was really bad. I mean, we talk here about the things we actually kind of knew, but the question of whether or not we put the emphasis in the right spot. But I think back then there was just vast majority of people had no way of actually knowing.
Yeah.
And I mean, I criticize the media now for how little we do to give people contextual information in the world of the internet. But back then, there actually wasn't any way to do contextual information in any reasonable fashion. I mean, maybe eventually somebody could write a book and they could go to and then people who really cared could go to the library and check out the book. But it was real hard, much less to get the actual text of a bill if you didn't live in Washington, D.C. So I don't think there's any doubt that we're in a much better place here today. I actually think that the broad set of changes here have been better for policy wonkery than anything else. But for that matter, I do think that we then have to sort of be honest that the issue here is not that these are warring CBO reports, and the problems we have are not that there are uncertainty bands around estimates. The problem is that we often don't do a good job with data, often because we're motivated to do a bad job with data. The example I like to use a lot, which isn't going to make me any friends in this room, but is the individual mandate. What happened there was not that sometime in 2008, the individual mandate became unconstitutional. It's that sometime in 2008 it got adopted by Democrats, and then there was a motivated effort to create sort of a lockstep opposition to what appeared to be a weak part of the bill. And this happens on a lot of things.
I don't agree with that, by the way, but I know, as you said, most people in this room won't, but that's all right.
So, but nevertheless, but you see it on other things. So I'll use an example people in this room will prefer. In the 2000s, you had an enormous liberal backlash against the power amassed to the executive under post-9/11 legislation, right? And you had an enormous amount of concern about government surveillance. You had an enormous amount of concern about government spying. If you look at polling now, Democrats are much more comfortable with what's been happening at the NSA than Republicans are.
Your broader point, which is that we tend to oppose, we tend to oppose the things, the initiatives of the other team, regardless of whether they're from a policy standpoint things that we support. I think that's fair.
And we cherry pick the information. So I think when we look at this stuff, the problem is not that the CBO is occasionally like that they can't predict the future. I think the problem is us.
Yeah, and I think one thing that's interesting as we think about what conservatives could do to reform the system is that problem will come back to bite conservatives to a large degree, because the conservatives are at least at risk of criticizing. For example, if you criticize disruption in the health insurance market, the like your plan point, which I think it's completely fair to hold the president accountable for the fact that he made that promise very definitively. They had a choice to include the asterisk and the caveats. They did not. It's fair to hold him to that promise, but you get to 2017, assuming that Republicans sweep the table and win the White House and the Senate, which is obviously not a done deal, and they want to change the system. What do they do to the people who like their Obamacare and want to keep it? Yeah, well, I'm actually fascinated to hear your answer on this, because this is a part of it. When I think about the politics of Obamacare, here's how it looks to me for the next couple of years. 2014, Obamacare is just clearly going to be a strong net negative for Democrats. How much it will lead to marginal seat pickup in the House and Senate for Republicans, What do you think is the driver of that? What do you think are the things about Obamacare that motivate voters to elect Republicans in 2014?
Individual things motivate voters just about at all. I think that if you look at the evidence on voters, they just, broadly speaking, they don't have hyper-granular takes on sort of policy issues. Obamacare is an unpopular bill that has been botched, at least in its early execution. I think that insofar as it has an effect on people's perceptions of Democrats and the Obama administration, it is that they are doing something that people are not super comfortable with, and they did a bad job on it, which in some ways is a little bit more unforgivable. Meanwhile, in 2014, you have two things that are very important in this, right? Because Obamacare was unpopular in 2012, too, but Mitt Romney and Paul Ryan did win the election. What you have in 2014 is a Senate table, although you had this a little bit in 2012, that is stacked towards Republicans. Because remember, it's the in-cycle election of 2008. And you have, somewhat more importantly, a demographic mix that is much friendlier to Republicans than 2012 was to Republicans. So you have an electorate coming out and a set of seats that are vulnerable. that I think are particularly likely to be activated and motivated by Obamacare. Whereas on the other side, I don't think a whole lot of Democrats are looking at what's going on and saying, this is great, I got to get out to the polls in November and ratify this. So I expect reasonably substantial gains for Republicans, although again, I'm not the kind of election analyst who will say it'll be 6 or 3, I have no idea, like the CBO. But then in 2016, you have the opposite problem, right? You have an electorate that shifts back towards Democrats in terms of the demographics. You have, I was actually looking at this morning, I believe it is 23 Republican seats up in the Senate and 10 Democratic seats up in the Senate. And you have somebody from the Democratic
It's the
Party.
2010 election,
Yeah, exactly.
in terms of
and then you have
6-year
somebody from the
intervals.
Democratic Party running, probably Hillary Clinton, who's going to be running on a sort of mend it, don't end it, approach to Obamacare. They'll have they'll be on the one hand proud of it, and on the other hand, here are my 82 improvements. And I think that's going to be a very interesting moment for the Republican Party, because I think that if you look at, you were asking what actually motivated people around it. The first very specific criticisms of Obamacare to get traction, I think, once the law was implemented. Prior to that, it was actually the cuts in Medicare that got a lot of traction. But after the law was implemented, it was taking away things people had. It was an appeal to status quo bias, right? But at that point, Obamacare is going to be covering somewhere in the range of 10 to 20 million people. And major changes to it will be taking health insurance away from somewhere between 10 and 20 million people. And the question of how whoever the Republican candidate is deals with that is one that I honestly, as of yet, can't answer, because I don't know how you could offer an approach to Obamacare that will be good enough in a primary and won't terrify folks in the general. And I'd like to hear how you think that'll go.
Well, I'll disappoint the audience by saying I agree with you completely. We do this often, Ezra and I. We disappoint people by agreeing more than we want to. But I think this is a problem too.
Why none of you paid for tickets for this roadshow?
I think that the Republican candidates in the primary are going to have to commit to repealing Obamacare and perhaps replace, some will say repeal and go home, some will say replace with a nod to this or that, interstate purchasing of health insurance, malpractice reform. Others will have a more perhaps substantive replace plan like the Senate, the Coburn-Burr plan. That's going to be the range of what's the Overton window of what you can do in a Republican primary is going to be that range of options. And to your point, I don't know if any of those options works in 2016 in the general, because you're going to have if you to take the CBO number, you're going to have by the end of 2016, I believe, 24 million people on the exchanges and 11 to 12 million on Medicaid, the Medicaid expansion. So it's like 35, 36 million people. Now, not all those were previously uninsured, but the point is those people are going to be on Obamacare-sponsored insurance. So if you repeal Obamacare, that's a lot of voters. That's, the illegal immigration problem that we're always talking about is unfixable. That's 11 million, illegal immigrants. This would be 36 million people. That is an extremely high number of people that you're saying, we're going to repeal Obamacare, disrupt your health insurance arrangements, and do something else with it. That seems to me like that's going to be a tough sell. And so my fear about 2016 is that the primaries are going to constrain the ability of Republicans to come up with something that's politically plausible in a general election as a way to approach the Obamacare problem.
Yeah, and I think one of the interesting differences between the Democratic Party and the Republican Party on health care in particular is the Democratic Party both had and has a set of validators. Prior to the last couple of years, Ted Kennedy was clearly sort of, Democrats looked at Ted Kennedy to see if a health care plan was something they could support. When Ted Kennedy left Medicare Part D, right, it became something that most Democrats, though not all, couldn't support.
He had the credibility.
He endorsed Obama, he made Obama safe in that way. And now it's the Clintons, one of whom will probably be running in the election. If Bill Clinton comes out and says this is a good healthcare idea, Democrats by and large are like, fine, that's a good healthcare idea. You're the Secretary of Explaining Stuff, you would know. It isn't clear to me, with the exception maybe of Ryan, who it is in the Republican Party who enough of the sort of the Republican Party influentials look to for that kind of validation that you could change the party's opinions on something like that reasonably rapidly. Because that seems to me to be the way this kind of opinion change has to work. You kind of need the key figures who other people look to, and then they become the key figures that other people look to, and kind of down the line until the grassroots.
There's no one person.
It's much more fractured on the Republican side on this particular issue.
I mean, there's a group that's wonkier that maybe where Paul Ryan's leadership would be influential. There's a group that's more the Tea Party activists, where a different set of thought leaders or opinion leaders, you might say, are influential, like a Ted Cruz. And those groups are fairly different and don't agree on a lot of this stuff, which is why, to me, repealing Obamacare will probably never happen, because if the Republicans can't get together and agree on what they would replace it with, then you're kind of stuck with a status quo bias, to your point. It's hard. In order for a replace plan or any plan to really be the Republican plan, you have to have that ability of consensus. Now, I think the one thing that goes against that, the one hope, to contradict my pessimism, would be that the presidential nomination process does consolidate relatively quickly, and so that the front runner has a little bit more political room to articulate something that may be controversial in some quarters, but unifies enough of the Republican Party that people get behind it. And I think that's really what you need. I mean, to your point, you mentioned Clinton. Clinton was a president. Ted Kennedy was not a president, but he was the closest thing in Congress to a presidential stature person. Yeah. So there's no one like that in the Republican Party, because George W. Bush is long gone, and there has been no one who's the uncontested leader. But if there were a presidential nominee, that person who had the support of the broad conservative movement, that person could play that role, if they're not completely constrained by the nominating process that they're boxed in.
Yeah, I mean, I think that's right. There's an enormous amount of policy construction that'll come down to the candidate. I'm fascinated, though. I mean, I think that in some ways Republicans this year haven't gotten enough credit. The big change to me in the Republican Party this year has been, this is kind of the year that the Republican Party is, or at least major players in it, are getting specific. So there were a number of years after Obamacare when Republicans shied away from offering any kind of specific plan, but obviously there was a big, serious, it was built on an earlier plan that nobody wanted to talk about for a couple of years, but a big, serious plan that could be, central to a Republican candidate's plan that came out this year. And then, I got to say, I was very skeptical that Camp was going to come out with a specific tax reform bill.
It's impressive that he came out with it. Yeah.
But he came out with, something that has real pieces to it, and not everyone is popular. And I honestly, I should just say, I haven't gone through it in enough detail to really even say, how good or bad an idea I think it is. But he really did do it, and he came up and he took fire specifically in order to create something, not that's going to pass this year, but that might serve as kind of a template for the future and be refined. Yeah. So I do think that the optimistic side of this case is that there are people in the party, not just who kind of want this to happen, but are beginning to take the risks to make it happen. What isn't clear to me is whether or not, when the folks are running, they're going to see that as a risk worth taking to join them or not.
Yeah, I think that's exactly right. I think that this year there's been a lot more policy entrepreneurship on these big questions on the Republican side than there has been in quite some time. And I think this is the year for it. I mean, a lot of people say, well, it's an election year. Well, every other year is an election year. So what are you going to do? You got to do it sometime. And I think a couple of years before the presidential is the right way to do it, because then these ideas can get refined, they can be criticized, they can be improved, hopefully. You can address some of the objections that people raise. You can crowdsource effectively the policy initiative, and hopefully by the time 15, 16 comes around, the ideas improve that way. But one thing I'm interested in from your side is, what do you think, if you had to, you said that Obamacare wasn't disruptive enough. What would, if it was President Klein or you were running the equivalent policy shop on the left, the CAP or whatever it is, how would you be trying to improve Obamacare?
I don't think I'm where they'd have me running CAP. Look, I don't think that I should be there creating the perfect policy for people, but I thought Wyden-Bennett was a better approach than Obamacare. I think there are...
Explain to people who don't know what Wyden-Bennett is.
Does anybody in here not know what Wyden-Bennett is? Come on, people. So there was a policy proposal put forward by Senator Ron Wyden of Oregon and then Senator Bob Bennett of Utah. Wyden, a Republican, Wyden, a Democrat, Bennett, a Republican. It ultimately had co-sponsorship, although the level of actual commitment of these co-sponsors in the range of 11 or 12 other senators from both parties, 5 or 6 Democrats, 5 or 6 Republicans. And in some ways it was similar to Obamacare, right? I mean, and for that matter to Ryan and Coburn's plan and others. It had a bunch of exchanges. It had subsidies that were coming through the tax system. It had an individual mandate. At that point, Republicans didn't all think an individual mandate was unconstitutional. But at the same time, it did some other much more disruptive things than Obamacare did. It dissolved Medicaid entirely and moved that over to the private insurance system. It bought out, sorry, that's not quite the right word. it had employers convert the amount of money they spend purchasing insurance for their employees and essentially give it to the employee to purchase insurance in the exchanges. So the exchanges essentially became, exempting Medicare and VA and a couple other pockets, really the central way people would purchase health insurance in this country. And so there's a much more unified approach. It was a lot less fractured than Obamacare and our current system is. And as a general point, I prefer approaches that are less fractured. I like multi-payer systems more than I like single-payer ones, just because I think competition between insurers is important. But I would like much larger exchanges. I'm not a huge fan of state regulation of health insurance and would like to see national exchanges. So I would do something that had a little bit more coherence to it. But of course, I wouldn't get elected because of that, right? I mean, the thing that so many different players learned after 1994 was whatever you do in healthcare, do not screw with what people have. And I completely agree with you. The Obama administration's promises on this point were wrong. They were lies. But that said, in the policy construction, they did try to screw with as few things that people had as they felt they responsibly could, and as such, they left tremendous swaths of the American healthcare system and very problematic parts of it untouched. And in particular, I think the individual market and the way poor folks got health insurance was the biggest problem for access. I think that in addressing that, you're addressing the right access problem. The employer market, and to some degree the Medicare market, are the biggest problems for cost. And I think the Cadillac or excise tax is a good start there. I would have liked to see a simpler approach to that, but it was what it was. But I don't think that we are doing enough there yet. For instance, I just joined a new company. And so we have health insurance, which is great for me, and it's very nice. But I actually had to go to the HR people and say, how much are we paying for our health insurance premiums here? And they had to go and check and tell me how much they were paying.
I've had the same experience.
And it's just odd. It's just an odd way to run a railroad. And there's nothing in Obamacare that ends that. Yeah. Nor is there anything in the Coburn bill that ends it, though I think it probably
get rid of the employer mandate.
It hastens its demise more than the excise tax does. Wyden and Bennett just ended it, more or less. Eventually, they tried to soften that a bit, but early versions just ended that. And I think just ending that would be a huge advantage for cost and competition.
We should mention that the reason why Bob Bennett is no longer in the Senate is because he was primaried by a guy named Mike Lee because he supported the Wyden-Bennett bill, which was seen as too much of a bipartisan nod, and so now we have Mike Lee in the Senate, who a lot of conservatives really like, but who presumably wouldn't be amenable to the Wyden-Bennett approach.
I think it would not be. I should say I think that Mike Lee's been, again, a really interesting policy entrepreneur this year on poverty and some transportation and other stuff, but yes, I don't think he'd be quick to sign on to Wyden-Bennett.
So what do you think, how do you think this will play out? Put on your Jimmy the Greek prognosticator hat. I mean, what do you see, what do you think is going to happen in 2014? What do you think is going to happen in 2016, given the constraints?
To
Obamacare? In terms of the, can Republicans win in 2016? Can they retake the Senate? Is Obamacare here to stay? Will it be repealed?
Yeah, so I don't make predictions on whether Republicans will retake the Senate just because my predictions on that are completely worthless. And it's just, you guys should leave if I do. I think Republicans will gain seats, whether it's retaking the Senate or not. I am confident saying Republicans will not get a 2/3 majority in both the Senate and the House. So from the perspective of Obamacare, it ain't going anywhere until at least 2017.
Do you think it's repealable? Do you think it's politically possible to repeal Obamacare in 2017?
Well, it depends on how you end up defining repeal, right? So let's say that, Hillary Clinton doesn't run or the Clinton campaign collapses and we end up with President Christie or Ryan or Paul or someone, and a pretty healthy Republican majority. So Republicans have and keep the Senate, they have and keep the House. I think at that point, I think there's a very interesting question of even whether in that world Republicans are going to decide to make healthcare the thing they do. Right? There are a lot of other things Republicans want to do that are going to be less of a war, that have less disruption of existing arrangements. You form a committee. The committee's going to report back in 2018 or 2019. We'll see where we are then. But maybe not. Maybe it's somebody who's really committed to doing something about Obamacare, say President Paul Ryan. At that point, I think that what you'll have to see is some kind of much more attenuated reform, even than where Ryan and Coburn are now, that sands off a bunch of pieces of Obamacare, does different things that people care about, ranging from new things like medical malpractice reform to trying to do some more stuff on the tax exemption, on the tax exclusion. Although that for a lot of people feels like a tax increase, So I mean, that I'll be very surprised if that could actually survive a process. Bringing down the level of essential benefits, bringing down the actuarial levels, all kinds of things that.
Some of the stuff that we've talked about.
Yeah, some of the stuff we've talked about.
Yeah.
And I think that will be called repeal and replace, right? I think the argument that would have to be made at that point is that Obamacare has been changed so much that it has been effectively repealed and replaced with a new thing. I do not think that it is going to be even a little bit possible to literally just uproot the whole thing, providing insurance, new insurance between 10 and 20 million, and as you say, insurance that is actually the core of the insurance arrangements for even more than that. I just don't think, I think not only would that be too publicly difficult, but as an operational challenge, it'd be tremendous. As a affront to industry, which is, Republicans talk a lot about uncertainty and the need to give industries the ability to invest going forward. I think the health insurance industry, the pharmaceutical industry would prefer to not have a huge upheaval again, as opposed to a more, modified process. So
Do you think Obamacare
that would be real tough.
Do you think Obamacare has been successful?
I think it is way too early to say. I think the launch was obviously a disaster, right? I mean, you don't pussyfoot around that.
I guess, how would you define success? What is success for Obamacare?
I think success for Obamacare is in a couple of years when the market is shaken out, that you are providing insurance options at a reasonably affordable level to tens of millions of people who are uninsured previously, and that you are beginning the transition, one, sort of away from employer-based care into the exchanges, and two, away from pay for volume and in towards pay for quality. I think if you really break Obamacare down, it's that access for the uninsured and the underinsured. It's that, I think in the long run, the attempt to create a model to which other parts of the system, possibly including Medicaid, can transition in the long run. And then three, the efforts to delivery system reform. I think those are really the three core elements of the law. And I think that we're at a point where it seems entirely plausible all three will ultimately be successful. It's not a perfect world. It's not an Irenic world. It's not anything anybody would have chosen as their first best option. But I think they could be successful. That said, we're at a point where they also could not be. I've mentioned I've been a little out of the news cycle the last month because I've been trying to build this new project. And it's actually been, I feel like as somebody who's been really deeply invested and involved in these debates, a kind of an interesting and informative experience because I kind of check in every couple of days and just see what people are talking about and arguing over the CBO report or the latest enrollment numbers. And in a way that I don't always, I knew this logically, but I didn't feel it as intuitively. Being outside of it for a little while really makes you a whole lot more willing to say, you know what, we'll see.
Right.
I don't know yet. Yeah. And I'm not going to find out tomorrow or this afternoon or a week from today. And in a couple months, we'll know more about where we are in year one. But also, I think that really Obamacare, I really think the question of the stabilizing the exchanges and seeing what your risk pool that's really year 1 and 2. And before anybody can even touch the law in any serious way, it's going to be at least 3 years in. So, I think we'll see kind of where we are at that point. And I really think, I don't know at what point the individual mandate bites and how hard it bites. I think that to me is still the big.
It's going to be a rude surprise because OFA and all those guys haven't been talking about
the
it's not, individual mandate.
I think it's a really different, this is a place where it's different than Massachusetts, right? The thing that makes me hopeful about it, because I'm somebody who wants the mandate to work, is that the deadline at the end of December to get coverage by January 1st, that got a tremendous amount of press coverage, despite the fact that it was not actually a deadline for anything.
Right.
People really knew there was some kind of Obamacare deadline, and you saw a huge December surge. So at the end of March, there's a much realer deadline, right? You actually pay a bunch of money, at least in most cases. And I expect there to be a fair amount of press coverage of that because we need things to write about, and Obamacare deadlines are a thing to write about in a very slow time for American politics. I actually have a slightly strange take on this, Owen, that I think a big enrollment spike is going to be in April. I think the way a lot of people looked at it is that there's going to be a massive run-up in March, and I think that's true. And then the people who are going to buy before the mandate will have bought, and then it'll sort of quiet down until the next time people are about to hit the mandate. I'm not sure I think that's right. I think a lot of people are just not going to understand the mandate. They're going to hit it in April. They're going to pay it and say, well, I'm not doing that again, and they're going to go and buy insurance. But that is a speculation based on nothing, so you should take it for what it's worth.
I mean, it's interesting. You described the three pillars of success: coverage expansion, affordability, and delivery system reform, having a more efficient healthcare system. It seems to me on those three metrics, I could see Obamacare failing. I've never been someone who says that Obamacare will collapse under its own weight and just magically vaporize. The law is the law. Laws aren't like businesses. When they don't succeed, they don't go away. I mean, I would say Medicaid's been a failure for 50 years. We're still stuck with the same statute, basically, that we had in 1965. But what's interesting to me is we may not have a massive coverage expansion. Certainly the Medicaid side may turn out to be fairly large, but on the exchange-based side, it's not clear that the people who are signing up on the exchange are previously uninsured people. It seems like, at least based on anecdotal surveys that people are doing, there was a big journal story about this earlier, that about 2/3 of the people or more potentially were previously insured people. And that means if there's an enrollment of, quote-unquote, enrollment of 5 million people, say, by the end of March, if 2/3 of those people were previously insured, then we really didn't address the coverage problem,
No, I think
the
that's
uninsured
right.
problem.
I think that's a huge point. But again, I think part of my point here is that I don't think the end of March is like the moment in which I'm going to say we've
You're going to
succeeded
wait a
or
couple
failed.
years. You're going to give it
Yeah, I mean,
3, 4,
I think
5
that you're,
years.
yeah, I mean, well, I think even 2 or 3 years, I think is going to help us see where the exchanges actually end up. I think this is something that and you and I have talked about this before. We have managed in a way that is sort of policy relevant but morally perverse to have structured a conversation around Obamacare, around this massive healthcare expansion, in which the main thing we are worried about is its success signing up people who do not really need health insurance that much, right? It's all about the young and healthies. How many of the young and healthies are we getting? Something that is true about a lot of the uninsured is not just that many of them are sick. It is that many of them are hard to help, right? And this is true in the healthcare system more generally. Something that I think you learn, and a lot of you guys have learned this firsthand, if you spend a lot of time with the people dealing with the really tough actual healthcare cases out there, not like healthcare policy in Washington, but I spent a fair amount of time recently with Jeffrey Brenner out in Camden, who's was in a Tolgwande's hotspotting article. Or there's a group who I really like who is doing some kind of amazing work in Pennsylvania trying to talk to sort of Medicare sickest folks. The big problems in cost and the really dangerous problems in access are often people, the problem there isn't just that they're sick and it's not just that they're poor. It's that for all kinds of reasons they are hard to reach and hard to help. They have trouble navigating bureaucracies. They don't speak English. They're oftentimes agoraphobic or depressed or mentally ill. Now, this isn't huge numbers, but in terms of, I think one thing embedded in coverage expansion is that we are not just covering people who are uninsured, but people who are also in need of insurance, right? So that, to me, is morally the most important group to insure. And I think it's going to take some real time to reach them. Something that Drew Altman at Kaiser, I think, said to me, is it something that he worries about is that we have a heavily computerized process here. It's not that we don't have navigators installed at community health clinics. We do have that too. But in some ways, the way you sign up for health insurance makes a lot more sense to me than it does to a 53-year-old Hispanic man who doesn't have a job and lives in interior California and never deals with the healthcare bureaucracy at all. And so one of the things that I think we need to see how it shakes out over a period of time is what kind of job we do and what kind of job we even try to do reaching these people. Because ultimately, for this thing, I think, to be a success in terms of who we helped, we do need to help people who are not easy to get in and are honestly not where even a dollar of our advertising and so forth is being pushed, because the advertising of the health insurance companies and the Obama administration, they're really trying to get the young and healthies in. That's what they want to do first. Then at some point later on, I guess Families USA is going to have to come up with the Enroll America Consortium and try to put some money in to bring in the hardest cases in. But in year one, I don't think we're going to get a lot of those really hard cases. And I think that the intuition we have in a lot of rooms like this one, where we say sick people really need and really want health insurance, makes sense because when we project ourselves onto sick people, we think, what would I be like if I was really sick and didn't have health insurance?
The problem
But
with
that's
federalized policy in general is that there isn't that.
I don't agree it's a problem with federalized policy in general, but I do think it's a problem with our conversation over this one. We've had a lot of state policies that don't just do a crappy job finding people hardest to help, but often make a huge effort to keep them out of the
I think what happens a lot of times, my observation as a conservative of what happens with Democratic legislation, and conservatives can do this too, Republicans can do this too, but they'll pass a law They say, okay, we did it. We passed a law expanding coverage or establishing this service for X population, and then they walk away and they don't worry about the whether the results are actually there, whether the law is actually cost efficient, whether there's whether or not there's waste and fraud and abuse, whether the outcomes, the health outcomes in this case, are any good. And it's a little different in this situation because there is a push to enroll people, because if people don't sign up, then the law is politically vulnerable. So I think it's not exactly the same as a lot of those other situations. But I think if Hillary wins in 2016, I can easily envision a situation where Democrats say, you know what, this law is now permanent. There's no way Republicans can ever get rid of it. Let's focus on other things. And that effort to reach the people who need the help will falter to some degree.
See, I actually don't think this kind of effort is one that comes out of the White House, just in general. And so I think I disagree with the kind of what you mean when you say people stop trying to update the laws. I definitely think there's a very real problem where laws and regulations get put on the books, and Congress's bias and the system's bias is so towards inaction, and the political bias is so towards new action, that we don't revisit our statute nearly enough. So I agree with that, although I think it is essentially an equal problem on both sides. It's a systemic problem across American politics. But there are a lot of people out there who spend their lives trying to reach these folks, trying to make these laws work. I mean, I think probably what's in your head there is Medicaid. Yeah. And the number of people in this country who, unlike, they're not sitting up here like in suits, like having a fancy lunch at the National Press Club. They have shitty jobs in shitty places, and they go out all the time and try to speak to people who don't speak their language and try to get them out of their house for the first time in a week and get them. There are a lot of people who are trying to make these laws work for the neediest. I mean, a lot of really good, really decent people. And they often don't get the money they deserve or the support they deserve. But that part of it, I don't think, is where we end up falling down. Again, I think that as a political system, we often fall down. But in terms of whether or not there are going to be folks on the ground trying to make the compassionate side of this work, trying to make the hardest cases happen, I think those people will be there. Whether or not they succeed, I think, is an open question. But I don't, in general, think that is somewhere where I think that these things don't come out of Washington.
There will always be nonprofits involved and people who, as you say, are working to help people in low-income situations. What I mean more is that the policy refinements that are needed to allow those programs to work well don't happen. So, for example, in the case of Medicaid, there's so much inertia with Medicaid that the policy changes that would be needed to ensure that, for example, physician access in the Medicaid program is more comparable to what it is for other people. That problem doesn't get solved because it becomes a fiscal problem. The states don't have any money left to spend on Medicaid. They can't do other reforms like, say, have premiums or copays and things like that because there's an ideological opposition to that, and there's a statutory opposition to that, and therefore the inertia or the thermodynamics, shall we say, is towards the system getting worse and worse and not being changed.
I think you see in Medicaid, particularly, a really good example of why you don't want to create these weird hybrid partnerships on these things, right? I think that if you compare Medicaid and Medicare, Medicare, I don't think people, I'm not saying literally everyone can go to literally every doctor, but you don't see the same level of problem. But I think you put your finger on it, right? I don't think the issue here is that people don't want to revisit some of these big bills. Henry Waxman's been around a long time, and there's no one on earth, I think, who has thought more about Medicaid than Waxman. He would revisit it every day if it was up to him. But it's a fiscal problem, right? And there are real disagreements here. So I think if you're asking, what will Hillary Clinton do with Obamacare in 2017 if she's elected, I think a lot of that question doesn't come down to her interest. I don't think that the scarce resource is going to be Hillary Clinton's interest in diving into the details of healthcare policy, right? That's not going to be where she fails. But I think there's a really open question if Republicans lose that election, if they are going to be willing to soften their stance on Obamacare and work to make reforms in it.
What do you think Hillary would change about Obamacare?
At this point, I actually have no idea. I would actually love to know that question. It's something I've thought about trying to do some reporting on, but the problem is at this point, very few Democrats are willing to start saying what they would change because they're not thinking about the law in the long term.
They're thinking defensively about
They're thinking defensively and tactically about it right now. And similarly with Republicans, very few Republicans are willing to say, here's realistically how I would compromise and change this law. It is very hard to get anybody in the political system for somewhat opposite reasons to say, well, you know what? I think here's a start we've made, and here are some ideas I have going forward. And in part, though, I think one reason is that some of the next set of ideas that make sense are very unpopular, right? So I think a big Republican complaint with the law are, one, it should do more on the tax exclusion for employer-based health care. That's not a political winner. That's a political disaster. And so nobody, there's, I think, laudable of Ryan and others to come out with that, but you haven't heard that many people saying, well, I'll take Obamacare and I'll add that in. Secondarily, there's the idea of...
Well, there is the Cadillac tax, so,
That's already there, but I think you could do a lot to make that a better tax, basically. Then there's the Medicaid piece, right? And the difficulty with the Medicaid thing, I mean, it was just embedded in what you said, trying to solve the problems of Medicaid, of folks on Medicaid not having access to doctors. To a first approximation, and there are things we can do here to ameliorate it, but it costs money. And Medicaid, one problem with it, it is fundamentally an underfunded program, and particularly underfunded in certain states.
It's underfunded given the way it's structured. I think a lot of people on the right would say if you took that same amount of money and had a market-oriented health care plan that was delivering coverage to those individuals, you could spend a lot less money than Medicaid spends.
I think a lot of people on the right would say that. And then I think that we'd write down the thing and we'd have to make choices, many of which would be very unpopular, about what are we saying people can't get, right? To make the money work out. It's like, and you know this very well, we're not without trade-offs here, right? There's no way to save the money without. One thing I kind of like about a lot of these healthcare questions, and it's true in the rate shock question about Obamacare and others, there's a mechanical nature to them. Like you change something and the cost goes up here. You tweak a dial here and the cost goes down here. And the question really ends up being where you set the dial. The biggest problem is kind of when we sit up here and things like this and we kind of talk in the generality, right? We can make it more market oriented and then it'll be cheaper. But along the way to make it more market oriented, at some point you write it down in legislation and somebody's losing something. But it's never how we describe it. And similarly, the Obama administration is paying for not describing some of the real trade-offs inside the bill they did. So I completely agree. You could restructure Medicaid, say, into a catastrophic healthcare program, and it would be cheaper, and you would be able to pay doctors for the catastrophic care, but you would be saying, it would be very hard then to say, well, I think the poorest people, it's not going to be easy for them to go get any preventive care at all or go to their first checkup, and it's a strange way to structure a program for the poor. Doesn't mean it may not be a reasonable idea. It's just not an easy conversation, and it's one reason it doesn't happen easily, because I don't think it's that people don't care about changing this stuff. I think it's that they can't get agreement on it.
So let's talk about the various Republican replace bills that are out now, because there has been, I think, an interesting evolution in that before there was Wyden Bennett, there was Patients' Choice Act from Paul Ryan and Richard Burr and Tom Coburn and a bunch of other people. Now we have the Burr-Coburn-Hatch bill in the Senate, which has been in the news a lot in the last month or so. There's the Tom Price bill in the House that has also gotten a fair amount of play. There's the Republican Study Committee plan. And I know that you often write about the Republican replace plans and kind of explain them to people and evaluate them. So how do you pick whichever ones you remember and have thoughts on? I'd be interested in your take on those plans, just both from a policy standpoint and from a politics standpoint.
Let me make a broad point as opposed to a specific one on them, which is that the thing that I'm always struck by when we really get into the details of healthcare policy, and it's part of why You're in My Roadshow never works, is that there isn't as much disagreement as you would think from the political heat. So something that always struck me about those plans, and in some ways they've now been rejiggered to show sharper levels of disagreement with Obamacare, but particularly if you go back to their predecessors, the big kind of initial problems Obamacare had in its launch, right? So the exchanges didn't work. The website development was a total disaster. There was a higher level of cancellation than people had understood from the political rhetoric. Those are not good problems for the law to have from the perspective of any of those plans. All those plans need the government and states to be able to effectively stand up exchanges. All those plans need people to be willing to say, okay, there's going to be some disruption and some losers here, but on the other end, we're going to have slower healthcare spending growth and other things that are worthwhile. And so one of the things that has really struck me is that the core competencies of both the federal government and state governments and the political system more generally actually need to be relatively similar across all the plans for any of them to work. I think that everybody kind of agrees that whether you like the program or you don't like it, the federal government is capable of, say, expanding Medicare to new groups, and it is capable of expanding Medicaid to new groups. That is something that is within its competency level. What has been, I think, less clear over the last 5 months, whatever it's been, is whether its competency level extends to a newer approach to delivering social service. And that competency, that kind of competency, is the competency would be required for the Republican plans too. And something that I thought we would have seen
A
by
little
now.
bit less so, because it's not like the Republican plan set up exchanges, right? The repeal and replace plan, even the Coburn-Burr Hatch, they say, here's the tax credit. We might, the tax credit isn't uniform. Some people will get bigger credits, some people will get smaller ones. But you go out and then buy whatever insurance plan you want with a certain
But they do
regulatory
set up-
bracket.
So I was thinking about broadly plans. So one, as I said, those plans in their initial form, say the one Ryan put out before Obamacare, did
Right.
have exchanges.
That is true.
And if you look in the Republican budget, they still call the thing they're doing to Medicare exchanges.
That is true too.
So,
But
I
that's
think-
that's different in the sense that here's how he would defend that is, it's one thing to take a single payer program like Medicare and move that into a regulated system using private insurers. That's moving it into a more market-oriented direction. Whereas what Obamacare did to the individual market is it took something that at the national level was regulated at the state level and federalized that and put a lot of costly regulations on top
Sure.
that made the plans less affordable.
I think you're defending an attack I'm not making. I'm not saying that Paul Ryan and Barack Obama support exchanges so that they are sort of ideologically equivalent but lying. I'm saying that Paul Ryan also needs a government to be able to competently run an exchange. Whether you're moving from single payer to exchanges or fractured
So
system to exchanges.
if Republicans were to reform Medicare, for example,
Yes.
they would need to be able to competently
Well-
set up exchanges in order to administer it. Well, they did
Yeah.
that with Medicare Part D.
No, absolutely. There was a reasonable plan on Medicare Part D, but that's kind of a little bit of my point here in terms of like what all these things need to work. Imagine that Ryan's budget had passed, and then on some date, all the seniors were supposed to go from Medicare into the exchanges, and on that date, none of the exchanges worked. That would be a huge disaster. So something that strikes me as similar across all of the plans is that people need to be able to have a federal government that can actually create these new kinds of structures well. And while Medicare Part D did ultimately work, it had a very bad first set of months. I mean, I've gone back and looked at a lot of that coverage just to remind myself, and it was a huge, huge, huge catastrophe. I remember actually something I'm not particularly proud of because I think the bill ended up working out well, but I was asked to be part of a blog at that point called Drug Bill Debacle. That was on TPM Cafe. That was all about the Medicare Part D's huge disaster and how it would never reflect. And I've gone back and looked at my stuff, and it's mostly just somewhat anodyne healthcare wonkery that wasn't highly specific to Part D. But there was a kind of, on the left, a similarly gleeful arising of sort of dancing on the grave of this program very early. But then, similarly, I think both of them are moving in the right direction. But something that we haven't seen that I think I would like to see as a place for cooperation is that there needs to be a kind of a modernization of the federal government's ability to administer, I think not just programs, but in particular digital programs, because that is how an increasingly large share of the American public does business now. And that's going to be important for Republicans, it'll be important for Democrats. And the fact that, as far as I can tell at this point, the federal government has made no changes to its procurement process, which led to a lot of the problems in Obamacare, that's not good for the left or the right.
So here's something I would, you've made a lot of points there. The one point I'm going to contest is that that these exchanges are very, very similar. There's definitely some thematic similarities if you're giving people a tax credit, letting them shop, but having some regulation around what the products are. But the thing about Obamacare with the insurance exchanges in Obamacare is that they're regulated in such a way that they massively drive up the cost of the insurance plan. Whereas if you take Part D, for example, the drug benefit in Part D by using a very modern insurance plan that was very much like what you'd have available in the private sector drove down costs because insurers could have things like copays and deductibles, steer people to generic medications, which they didn't have before. And so the challenge to me is you're right that there's an issue of competency with building the website and all that, but eventually those problems get fixed, and the thing you're still stuck with Obamacare is a system that has made health insurance for the unsubsidized population less affordable, not more affordable.
So I think that obviously you and I have some level of disagreement on where is the right place to put the dial on this stuff. And I don't have super strong opinions between like should we have a 65% actuarial minimum or a 67 or 62 or a 57. What I will say is when you go back to the Ryan exchanges from the original bill, they had a limit.
Just to be clear what we're talking about the 2009 Patients' Choice Act, which was a bill introduced by Paul Ryan and Devin Nunes in the House and Tom Coburn and Richard Burr in the Senate.
In that bill, the exchanges had a minimum that was tied to the FEHBP minimum. So one, that had a certain level of bringing up the bottom there too. There's a lot of mini med plans that just would not work under that system. So they would go up in price. But then you get into this broader question, right? Which is what level of regulation of who can buy should we have? So there's been, I think that if I remember your view on this correctly, and you can correct me if I'm wrong, Obamacare says you can do age rating at 3 to 1. You think it should be closer to 5 to 1.
Or even 6 to 1.
Or even
just get
6
rid
to
of it
1.
altogether.
So I think that we can have a debate between that. I actually probably lean more towards 3 to 1, but I could be convinced in the other direction on that. But that's really a question with losers on both ends, right? It's
You
not
see that
like,
as a technocratic question rather than an ideological
I
question.
see it as 100% a technocratic. No, I mean, it has value levels, right, in it. Like, you have to ask yourself, are we building an insurance system for the people who need insurance most or the people who need it least? And I do think that's part of it too. And then, of course, there's a question of how you deal with pre-existing conditions. That also drives up prices considerably. So I think anything where you had an exchange that was dealing with access problems, which was the hope in all of these plans, you would have some level of it. I buy the idea that Republicans would put the dial somewhere where on the margin it would be somewhat lower. But I don't think those would be costless changes by any degree. It's not just we're driving up the price of insurance, we're driving it down for people who have a lot of trouble affording it and need it very badly. So if, I could see the argument that you want to do the opposite thing, but it's an argument and it's not an easy one. I don't think I feel super good about any place we could come down there.
All right,
because I don't think any of them are easy.
Let's do some questions. What do you say, Grace Marie? Is that what you...
I think we can take maybe, I don't even know
Are we
we have
out of
microphones out
time?
there. I think we're out of time.
Okay.
But we want to thank you both very much. Wonderful discussion.
Thank you very much,
all
Ezra.
very much for coming. And join me. Thank you very much for a very good discussion. And thanks so much to all of you for joining us today. Thank you for those of you who joined us virtually. And clearly, this is a conversation that will continue. So thank you so much. Bye-bye.